Vanakkam, good morning. In this video, we are going to discuss about the dead space volume. Dead space volume is the amount of air present in the conducting airways. Up to 16th generation of the respiratory tract is called as the dead space volume. It does not take part in the gas exchange. Dead space volume is again divided into the two types. Anatomical dead space. The anatomical dead space is the amount of air present in the conducting airways is called as the anatomical dead space. Normal anatomical dead space volume is the 150 ml. Normal tidal volume is the 500 ml. The 500 ml 150 ml is anatomical dead space. Remaining 350 ml is involved in the gas exchange. The alveolar dead space is the air, some of the air in the alveoli does not take part in the gas exchange, that is alveolar dead space due to the less blood supply to the alveoli. For the normal people, alveolar dead space is negligible, very minute amount. The physiological dead space is the sum of the anatomical dead space plus alveolar dead space. Alveolar dead space is negligible, so anatomical dead space almost equal to the physiological dead space. Alveolar dead space is negligible in pathological conditions or respiratory conditions, it is increases. And the measurement of dead space volume by a Radford formula. The Radford formula, the dead space volume equal to the weight in bounds. The average 70 kg men weight in bounds is 150 pounds, so the dead space volume is 150 ml. And another one technique is a single breath carbon dioxide technique. This is mainly used for measuring the physiological dead space. In the single breath carbon dioxide technique, carbon dioxide is produced from the tissue, so that is measured and use the equation. That equation is called as the Bohr equation. Bohr equation is helpful to measure the dead space volume. This is the MCQ point. So Vd is the dead space volume. Fex is the concentration of the carbon dioxide in the alveolar. Fex is the concentration of the carbon dioxide in the mixed expired air. V is the expiratory air volume. Fax is the concentration of the carbon dioxide in the alveolar air. So Bohr equation is used to measure the dead space volume. This is the MCQ point. Single breath nitrogen technique is the another one technique. It is used for measuring the anatomical dead space volume. Single breath nitrogen technique, another name is Fowler's method. Single breath nitrogen method, otherwise called as the Fowler's method. In the single breath nitrogen method, normal air contains nitrogen, so first we ask the subject to take 2-3 breaths of normal air, then we ask the subject to take the 100% oxygen. So when the person is inspire the air, the last part of the air is dead space volume. So during the inspiration, the last part of the air is the dead space volume. During the expiration, the first part of the air is the dead space volume. So it is measured in the graph like this. So the dead space volume is, this is the dead space volume. Okay. During the inspiration, this is the last part. During the expiration, this is the first part. So it gets the 4 phases. When we record the graph in the Fowler's method, It is gives a S-shaped curve. It first part is contains only no nitrogen. Second part is mixed air, nitrogen because alveolar air and conducting zone is mixed. So the dead space is this area contains dead space volume. Type 2 is the mixed air. This is only alveolar air. Okay, alveolar air. This is the fourth. This is also contains nitrogen. This is start from the closing volume to the residual volume. Okay, closing one. In this area, at the level of the closing volume, all the transmural pressure is decreases. The respiratory bronchioles are closed when the volume is decreased below this level. Okay. So the dead space volume also measured by the planimeter. Planimeter. So this is the dead space volume around 150 ml. This is the alveolar air by the planimeter. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.